Hi everyone, Dr. Sam Gaston here again with North Texas Sport and Spine, continuing the video series about the office and some of the things that we offer here. So as a chiropractor, one of the main treatments I use is the chiropractic adjustment. And these adjustments or mobilizations or manipulations, as they can also be called, are safe, minimally invasive treatments that can be performed by chiropractors, physical therapists, and even some DOs. For me, the goal of the chiropractic adjustment is to restore motion to a joint that's restricted or not moving correctly. Through the exam that we do, I'll analyze the joints in the affected area, try to find any tight, restricted areas that may need some motion added to it, and then, when appropriate, supply a force in that direction to allow normal joint function to return to that area. When most people think of adjustments, they think of the spine, but an adjustment can be performed on any extremity, from the wrist to the shoulder, ankle to the hip, and really anywhere in between. There are multiple different techniques to perform the adjustment, and while I typically use a more hands-on approach, there are some less invasive, lower force techniques that can be used when appropriate, whether that be for someone with osteoporosis or just someone who doesn't want as much of a hands-on approach. At this point, most people are familiar with chiropractic adjustments, whether they've seen the videos on YouTube or TikTok, and they know that some joints will pop or crack when they're adjusted. When this occurs, it isn't a bone breaking or anything serious like that. It's not even the bones coming together and making contact. It's just a gas bubble within that joint that's popping, and that causes the sound. With most adjustments, the joint is moving a very small amount, even though sometimes that sound can be dramatic and very loud. While these pops are satisfying, they aren't the main goal. A joint can move without popping, and that movement is what I'm really focused on restoring. Something all joints have in common is that they do have muscles crossing them, so it's important to make sure that appropriate work is done to those muscles while the whole area is being evaluated. And in my next videos, I'll be detailing some soft tissue techniques that I use to make sure that all parts of the musculoskeletal system are being taken care of.